Amidst the COVID-19 pandemic, the national government, the whole of government, whole of society, and even whole of community approach has been working closely with the different local government units to ensure vaccine accessibility to each and every Filipino through a quality, effective, safe, and free COVID-19 vaccination program. In the National Capital Region, we already visited 16 local government units out of the 17, and this is the first outside of Metro Manila C.O.D.E visit. With the Philippine National Deployment and Vaccination Plan for COVID-19 vaccines in hand, the COVID-19 vaccine cluster headed by no less than Secretary Carlito Galvez, together with IATF principals, is conducting the vaccine C.O.D.E visits to the different local government units and some specific health facilities, one of which was visited by Secretary Duque, the Philippine General Hospital, to present the national plans and form coordinative mechanism for the deployment of the vaccines and the implementation of the COVID-19 vaccination program. The C.O.D.E team visit is composed of 3 teams, Team A, B, and C. Team A is headed by Secretary Galvez, B is headed by Secretary Vince Dizon, C is headed by Secretary Duque. Each team has been assigned specific areas or LGUs. And we came here, let me emphasize, we came here not to approve, neither do we disapprove the plan that will be presented later. We came here to coordinate, to be in coordination and to form coordinative mechanism to review and to see where the national government can help in the implementation of your COVID-19 vaccination plan. All of this we do because we want economic recovery. And as they say, we heal as one, we work as one, and we bakuna as one. Before I end this little briefer, please bear in mind that ang bakuna pong ibibigay sa atin ay ginto. Kaya kailangan po hindi natin ito sasayangin. To acknowledge our guests, please welcome the Honorable Mayor of Davao City, Honorable Sara Duterte.
Thank you. Please take your seats. Maayong udto sa inyong tanan. On behalf of the City Government of Davao, I would like to welcome the members of the C.O.D.E team, led by our honorable secretaries, and everyone gathered here for the simulation exercise and for updates on the COVID-19 vaccination program. Today's visit is one that is certainly a cause for hope. Here we are, a year after the initial entry into the country of a virus that has since claimed the lives of 11,000 Filipinos. And now we are finally awaiting the arrival of the vaccines. Vaccines that will hopefully signal the beginning of the end of the scourge that is COVID-19 and lead us on the road to socio-economic recovery. We thank the members of the vaccine cluster together with the interagency task force principals for conducting this C.O.D.E team visit to present national plans and form coordinative mechanisms for the deployment of the vaccines. We shall also be sharing with you our present situation here in the city as well as our vaccine deployment plan. We look forward to the rollout of the vaccines, the inoculation of Davaoenos, and the eventual achievement of herd immunity. For while we do not know when this pandemic will end, we are at least certain that soon we may finally glimpse the light at the end of the tunnel. Thank you, ug maayong ugto usab sa inyong tanan.
Thank you, Mayor Sara. And to further acknowledge our guests, we have with us Secretary Carlo Alexis Nograles, CAB Secretary and the Vice Chair of the IATF. We also have the presidential spokesperson and the look-alike of Isko Moreno, Secretary Harry Roque. I always add that look-alike to add the humor so that we are not so serious. And of course, my very own Secretary Francisco Duque of the Department of Health and the Chairman of the IATF. And the vaccine czar himself, Secretary Carlito Galvez, the Chief Implementer of the National Task Force Against COVID-19. We also have some Davao City LGU officials, Honorable Danilo Dayanghirang, City Councilor, Davao City COVID-19 Task Force officials, headed by Dr. Ashley Lopez, representatives from the Southern Philippines Medical Center, Dr. Ricardo Audan, the OIC Medical Center Chief, Dr. Maria Eleanor Concha, the Chief Training Officer, representatives from the Davao Center for Health Development, headed by Director Annabel Yumang. Now, from the National Task Force Against COVID-19 officials, we have Director General Eric Domingo of FDA. We have Yusek Epidemic, DILG for operations. We also have the National Task Force Medical Consultant, Dr. Ted Herbosa. Dr. Gloria Balboa, Director for Department of Health. And also Director Aleli Ani Sudjakal, Director for the DOH. Some representatives from Region 11, Regional Government Agencies, Director Frances May Makapagat, Regional Director, PIA, Director Deborah Legaspi, Mindanao East Cluster, FDA, Dr. Alan Fernaso, Regional Director, DepEd, some local officials, Dr. Josephine Villafuerte, COVID-19 Vaccination Cluster Head, Director Manolito Orense, RTF and OCD Head, Director Alex Roldan, DILG, PCO Rainier Diaz, Operations Head, PNP, Deputy RDO Edgar Alan Okubo, PNP, and we also have some staff from OPAP and from our media partners are also here with us. So let me give now I am Dr. Paz Corrales, the ARD of the Center for Health Development, National Capital Region. May I call on my co-MC?
Thank you, Dr. Corrales, for that, for the acknowledgement of all the important people na andito ngayon. Important, especially in our response to this COVID-19 pandemic. So at this time, we shall now move to let's have a glimpse of the National Action Plan. So we'll have an audiovisual presentation on the National Action Plan Phase 3. Eyes on the screen, please.
Mahigit isang taon na ang nakalipas nang magsimula ang pandemya ng COVID-19. Ang pagkalat nito ay nagdulot ng matinding dagok sa buong mundo, kabilang na dito sa Pilipinas. Ngunit sa pamagitan ng iba't ibang hakbang na inilunsad ng gobyerno laban sa COVID-19, unti-unti nang nakakabangon ang bansa habang nilalabanan ang virus. Marso nung nakaraang taon, ipinatupad ng Administrasyong Duterte ang Phase 1 na National Action Plan against COVID-19. Layo nitong matugunan ang krisis sa kalusugan. At dahil dito ay nagtulong-tulong ang iba't ibang ahensya ng gobyerno sa pag-iwas, pagkontrol at pagpuksa sa virus. Nakatuon din ang estratehiyang ito sa pag-iwas sa mga negatibong epekto ng COVID-19 sa pamamagitan ng tuloy-tuloy na paghahatid ng pangunahing serbisyo sa mga mamamayan. Hulyo 2020. Nang ipatupad ang Phase 2 ng National Action Plan na nakatuon naman sa health at economic recovery ng bansa. Nakabatay ang estratehiyang ito sa hammer and dance theory. Ang hammer ay tumutukoy sa pagkontrol ng kumakalat na virus tulad ng pagpapatupad ng mahigpit na community quarantine measures sa iba't ibang lugar, habang ang dance naman ay tumutukoy sa pagpapagaan sa epekto ng pandemya sa ating ekonomiya. Sa pamagitan ng mga hakbang na ito, patuloy na bumababa ang bilang ng mga kaso ng COVID-19 habang unti-unting nagbubukas ang ekonomiya ng ating bansa. At ngayon, ang Phase 3 ng National Action Plan ay magsisilbing transition plan patungo sa new normal at paghahanda para sa Philippine National COVID-19 Vaccine Roadmap. Layunin din nito ang dahan-dahang pagbubukas ng magandang ekonomiya sa bansa. Ang tatlong pangunahing estratehiya nito ay response, vaccination, at recovery. Sa response stage ng NAP3, nakatuon pa rin ito sa PDITRM strategy ng pamahalaan o ang prevent, detect, isolate, treat, reintegrate at mainstreaming to new normal. Patuloy pa rin papatupad ang zoning containment strategy or community quarantine sa mga lugar na may matataas na bilang ng mga kaso ng COVID-19. Ang apat na zoning classifications ay critical zone, containment zone, buffer zone, at areas outside buffer zone. Layunin nito na mapigilan ang pagkalat ng virus at ang epekto nito sa lokal na ekonomiya upang patuloy na magabayan ang bawat local government unit sa pagtugon sa COVID-19. Binuo ang Operation Listo Protocol at nakasaad dito ang step-by-step guide na maaaring ipatupad sa iba't ibang lungsod o munisipalidad. Ito ay nakabatay sa mga consolidated guidelines sa prevention, detect, isolation, treatment at reintegration. Sinusuportahan nito ang mga umiiral na programa at pagsisikap ng mga LGUs. Tuloy-tuloy din ang C.O.D.E visits o Coordinated Operations to Defeat Epidemic, isang patient at community-focused response strategy na sumusuporta rin sa mga LGUs lalo na doon sa mga may limitadong resources. Gayun din ang Oplan Kalinga program kung saan ililipat sa mas maayos na isolation facilities ang mga COVID-19 positive patients na walang sariling kwarto o banyo sa kanilang tahanan para sila ay ma-isolate. Ito ay upang mas lalong mapaigting ang isolation strategy ng gobyerno at mapigilan ang pagkalat ng sakit upang maging mas accessible sa lahat ang treatment services. Patuloy pa rin ang operasyon ng One Hospital Command Center o OHCC para mabilis na makatugon sa sinumang nangangailangan ng emergency quick response. Sa vaccination stage, nakaangkla ito sa 4 na operational phases: assess, plan, prepare, execute. Para sa assess at plan phase, narito ang mga sumusunod na estratehiya. Number 1, pagbuo ng mga mekanismo tulad ng Vaccines Expert Panel, National Immunization Technical Advisory Group, at Health Technology Assessment Council para makapagsagawa ng scientific evaluation at selection ng vaccines. Number 2, pagkakaroon ng portfolio ng vaccines mula sa iba't ibang bansa. Number 3, pag-issue ng Emergency Use Authority mula sa FDA. Number 4, pagbuo ng isang interagency vaccine cluster na may task groups at sub-task groups. Number 5, ang pag-mobilize sa private sector support para sa logistical at support services requirements. Number 6, ang pagkakaroon ng information system para sa profiling, screening, at registration ng mga eligible para sa bakuna, vaccinators, at ang mga supply chain facilities. Number 7, ang pagbuo ng monitoring at evaluation system. Para naman sa prepare phase, narito ang mga sumusunod na estratehiya. Number 1, ang pagkakaroon ng advance market commitment sa mga private vaccine developers at pagbibigay sa kanila ng advance payments kasama ang Asian Development Bank at World Bank na siyang mga financiers. Number 2, pagkakaroon ng mga diplomatic engagement para sa government-to-government at multilateral engagement. Number 3, pagkakaroon ng iba't ibang mode of financing. Direct procurement through RA 9184, COVAX facility, multilateral loans, bilateral loans, private sector financing through a tripartite agreement. Number 4, capacity at capability building para sa mga pasilidad at vaccinators para sa vaccine storage at deployment. At para sa execute phase, ito ang mga sumusunod na estratehiya. Number 1, pagpapatupad ng information, education at communication campaign plan at social preparation ng vaccination mula national hanggang barangay level. Number 2, pagkakaroon ng geographical at sectoral prioritization criteria para sa vaccine deployment. Number 3, paggamit ng supplemental immunization activity mechanism for COVID-19 immunization. Number 4, pagkakaroon ng epektibong waste management system para sa collection, transport, treatment, at disposal pagkatapos ng pagbabakuna. Para sa recovery stage, layunin itong mabawasan ang COVID-19 transmissions habang unti-unting binubuksan ang ekonomiya ng bansa at makabangon mula sa mga economic losses. Habang di pa ganap na nawawala ang COVID-19, sisiguraduhin pa rin na ang bawat establishmento, malaki man o maliit, ay sumusunod sa minimum health standards at sa mga protocols na ipinapatupad upang patuloy na maprotektahan ang bawat isa. Ngayong 2021, ipatutupad ng pamahalaan ang Phase 4 ng National Action Plan. Dito ay pagpapatuloy at paiigtingin pa rin ang mga tugon at aksyon para mapangalagaan ang kalusugan ng mga Pilipino habang namumuhay sa gitna ng pandemya. Ilalatag din ang mga plano, paghahanda at pagpapatupad ng National Vaccine Roadmap.
Many lives were lost and forever changed due to COVID-19 pandemic and several natural calamities. But through it all, we continue to survive and rise because of our unity, strength, and indomitable spirit as Filipinos. We should always have hope, even in darkness, poverty, and suffering.
Ang National Action Plan ay patunay na may plano ang pamahalaan para sa kaligtasan, kalusugan at kinabukasan ng bawat mamamayan. Inilunsad ito upang tayo ay makabangon mula sa mga epekto ng pandemya. Kaya mahalaga ang inyong kooperasyon at pagkakaisa. Basta sama-sama at laging handa. Kaya natin ito.
There goes the National Action Plan Phase 3. Sobrang nagbibigay po ng hope sa ating lahat as we transition back, kung hindi man to what used to be our normal, but at least near normal. So at this point, we would like to acknowledge some of the DepEd officials. Joining us here today is the Regional Director, Sir Alan G. Farnazo. Sir, good morning. And we also have the Principal too of Mabini Elementary School, Ma'am Cherry Ledesma. And to all the teachers and staff na talagang naghanda po sa araw na ito, good morning po and welcome po sa ating meeting today. So at this point, we shall have the Davao City Situationer and COVID-19 Deployment and Vaccination Plan, and this will be presented to us by the OIC City Health Officer, Dr. Ashley Lopez.
Magandang tanghali po sa lahat, lalo na sa ating pinakamamahal na Mayor Inday Sara Duterte. And to all our distinguished guests who are present today, to our regional officials, government officials, and everyone. Also, I would like to acknowledge the presence of the members of the COVID-19 Task Force for Davao City, who came here today for this event. Now I'm going to present the Davao City COVID-19 vaccination preparedness. But before that, I would like to make an overview of a brief situation actually of what really is happening in Davao right now in terms of our COVID-19 operations. Slide, please. So, as of February 13, 2021, the total cases of COVID-19 for Davao City already reached up to 12,437. Among these, the active cases is at 1,306, which accounts for about 10.5% of all COVID cases in Davao since the beginning of the first case of COVID-19 in March of 2020. For our recoveries, we have 10,533, 84.69%, which is actually way below the national rate of 93%. But safe to say we are getting better because in the previous months, we even have a very low recovery rate of 66, 68, as far as I remember, in the past few months. Then it went up to 70, 75, and now we have actually 84.69% recovery rate. And it's getting better. So for our deaths, unfortunately, we have 598 deaths. It accounts for about 4.8%. And again, this is way above the national rate of 2.1% in terms of the case fatality rate. So our cases with final outcome already reach up to 11,131, which accounts for about 89.5% of the total cases of COVID-19. Next. This is the growth rate of COVID-19 in Davao City, which ideally, if you notice yung ating pong yellow line dyan is the yellow trend line, which ideally supposedly should be rising and dropping, no? And for Davao City, as of January 4 and January 4 to January 10, if you notice, meron po tayong sustained spike doon sa level, doon sa may bandang dulo. No, first week of January, and this is because of the surge on our post-holiday, no, season like the Christmas and the New Year. But as of the first week of February, we again seen a slow downtrending of our cases. Next. So this is actually the confirmed COVID-19 cases by date of onset of illness. Showing you from March up to the, and right now we have yung number 1 po dyan is morbidity week 1, which is actually the first week of January. Then morbidity week 2, 3, 4, 5. Yung 5 po is first week ng February, and yung 6 is yung second week ng February. So if you see, the highest or the peak we have was in the first week of January, wherein we have a total cases of 801. But it went down slowly. Actually, by week morbidity week 5, we already dropped to 300 plus cases, and ultimately last week, which is the week morbidity week 6, we have already dropped down to 200 plus cases. So sana po, hopefully, tuloy-tuloy na po yung ating pagbaba ng kaso dito sa Davao City. But we are very, very hopeful because of the sustained mitigating measures that has been done in Davao City, including our restrictions. Thank you. Next. So as to the age group, predominant pa rin yung ages 20 to 29 and 30 to 39 years old. So kadalasan po nang naapektuhan yung mga nasa middle age group or working group, no? As we say, because expectedly they're the one who's going out most of the time, they're the one who's working. So sila po yun. With the ongoing community transmission, they are the most exposed. Kaya expected po yung ganitong klaseng presentation. Next. For our those died by age group and sex, if you notice from ages, those age range 40 years old to 49, 50 to 59, up to 90 to 99 years old, this accounts for about 80% of the deaths that we have, cases of deaths that we have in Davao City. And among these, 16% of these cases are actually died. Next. So this is the reproduction number. If you can see again, there is a slow downtrending of our reproduction number. It ranges from 0.3 to, the lower limit is 0.3 to 0.5, and the upper limit is actually 0.7 to 1.22. The last time I reported to the task force, we had the highest limit of 1.87. But as of last week, we have already dropped our reproduction number to 0.55 to 0.7. Next. And as to the risk, the LGU risk assessment, this is based on the 2-week growth rate and the average daily attack rate. For the past weeks, the past month, the average 2-week growth rate for Davao City is actually at -45, which is classified as low. And for our average daily attack rate at 2.5, which is actually classified as medium. For overall, our LGU risk assessment rate for the past 2 weeks is at low risk. Although we still have identified 3 barangays who belong to critical risk, pero if you see the numbers, hindi naman po ganun kalakihan ang numbers po, except for the Tugbok proper. We have rose up to 23 cases for Tugbok proper because we have an incidence of outbreak in one of our adult children facility in Tugbok. Pero yun po yun sila, fortunately po, contain po yun sila kasi na bilong po sila sa isang tinatawag naming bahay pag-asa. So, nag-provide po kami ng isolation tents doon. So, there were no risk already of any outside or community transmission from these cases. And for the rest po, we have 4 high-risk barangays, which is actually Barangay 11B, 14B, 39D, and Malabog in Paquibato, our far-flung barangay. And we have about 11 belonging to moderate risk barangays, and the rest of 182 barangays in Davao City already classified from low to minimal risk barangays. Yes. So this is our COVID-19 testing in Davao City. We have an average of about 800 testings per day. And if you notice, the gray line is actually our positivity rate po, no? Which actually very erratic. Minsan umaakyat po kami ng 16%, 14% to as low as even below 5%. And as of yesterday, ang aming positivity rate with 53 cases was at 6.3%. And as of last night, 6 p.m., as reported, we have one of the lowest incidents for COVID-19 at 11 new active cases out of the almost 300 that was tested. So for today's positivity rate, we have a positivity rate of 4.6%, which is actually the first time when we reach below the threshold, WHO approved threshold of 5%. Next. So for the proper presentation proper for the pre-vaccination activities, actually we for establishing COVID-19 vaccination operation center, this is already done. So check na po yan. Next. So ito po yung actually yung ating organizational structure, no? With our Davao City Task Force COVID-19 as the overall agency that manages and supervises the COVID-19 operations in Davao City, which is headed by no other than our City Mayor Inday Sara Duterte, together with the Secretariat, our City Administrator's Office. And we have classified the operations into 3. We have Operation Center A, Operation Center B, and Operation Center C, made up of the response cluster in A. Our Operation Center B is actually our vaccine cluster, headed by Dr. Villafuerte. And our Operation Center C, our recovery cluster, which is headed by our DCIPC office. And we have an existing operation center also that manages our call takings, no? Data management, monitoring and supervision, public hotlines, and private hotlines for the response cluster members. And this composes the response cluster. So hindi ko na po i-enumerate, no? And next, after the response cluster, under cluster B, we have the vaccine cluster, which again headed by our former City Health Officer, Dr. Josephine Villafuerte, and the rest of the group. And for our recovery cluster, which is headed by Miss April Dayap, our department head for our Davao City Investment and Promotion Center. Next. So for our capacity building and trainings, we have several trainings already done for the city. Next. As early as January, we had a training on COVID-19 vaccination, then roll out in January 27 and 28, and we had a VigiFlow and AEFI training in February 9, which is conducted by the Department of Health in coordination with the City Health Office and the CESU. Next. So the Vaccine Information Management System, which was done recently, February 12 and February 13, conducted by the Davao Information and Communications Department. Then the cold chain management training for COVID-19, which was recently done last February 13, which was conducted by the Department of Health and participated by the City Health Office of Personnel. Next. Master listing. As far as master listing is concerned, we have already completed the Group A master listing among those groups that are indicated for COVID-19 vaccination. For the summary of priorities for Davao City, the priority 1, the frontline health workers, we have about 16,677 identified. For priority 2 and 3, which actually corresponds to the senior citizens, we have a total number of 77,189. For priority 4, indigent population, we have 432,549 indigents. And for lastly, under priority 5, pertaining to our security sector or the uniformed personnel, we have 5,258 for a total of 537,820 for our priority A for Davao City. So ito po actually yung sequence ng sub-prioritization plan ng Group A1 workers in frontline health facilities, including those in trainings like students and interns. So the priority would be COVID-19 referral hospitals, dedicated hospitals, and that would already include our Southern Philippines Medical Center, hospitals who are catering COVID-19 cases, including our private hospitals. We have quarantine, isolation, and facilities that includes also our temporary treatment and monitoring facilities. And the rest, we have the government-owned community-based primary care facilities, the remaining private healthcare facilities, and other healthcare institutions. So ganito po yung sequence ng ating vaccination. Next. For our master listing, the healthcare workers were taken care by our City Health Office through our district health offices. Then we have the senior citizens under the OSCA, and the indigent population, which was taken care by our City Social Welfare and Development Office. And for our uniformed personnel, we have the Armed Forces of the Philippines, the PNP, the Bureau of Fire, and including our CAFGO. So these are the master listing activities that was done in Davao City. So meeting with the district health officers in February 1 and 6, which was supervised by the City Health Office and the district health offices. Then meeting with the private and public hospitals on master listing and sub-prioritization last February 5, which was again conducted by the City Health Office. Coordination with Business Bureau on listing of private health facilities, which was done sometime in February. And this was done also coordinated with the City Health Office and the Business Bureau Office. Next. For our private clinicians, it was including the Davao Medical Society and the Philippine Pediatric Society, done. Our dentists and private dental clinics through the Dental Association was also contacted with ongoing master listing. And for our dialysis centers, through the Association of Dialysis Centers, they were already contacted and ongoing po din po yung ating master listing for them. And for our midwives and lying-in clinics, through the Integrated Midwives Association of the Philippines and the district health offices, this was done. And we are just waiting for the endorsement of the DICT on the VIMS IR registry access and instructions. Because as we know, nagkaroon po ng technical adjustments po sa ating registry, no, from the CEIR. Now, it is been endorsed to the DICT for our VIMS IR. So, we have also healthcare workers in the barangay health centers. The ongoing po yung master listing, COVID-19 operation centers and TTMF, ongoing din po yung master listing, which is being supervised by the City Health Office. Then we have healthcare workers in the hospitals. Contacted and meetings were already conducted and ongoing po yung master listing. And health workers in the private facilities also with list retrieved from the Business Bureau and ongoing po yung communications with these facilities. So for identification of vaccination teams, we have already organized our vaccination teams composed of at least 6 members per team, made up of a supervisor, which is a physician, a registration and screening also physician or a nurse or a midwife. They have at least 1 counselor, 1 vaccinator, and 2 staff that is responsible for recording and documentation. So in each vaccination site, we're going to assign 3 teams. So 6 times 3, that's about 19 vaccination members per site. For our adverse effect, following immunization composite team, it is composed of a monitor. For monitoring, we have the paramedic, nurse, and midwife, and surveillance officer for our responsible for our surveillance, which is also will be put up in our vaccination site, composed of 3 teams. So 2 times 3, that's about 6 staff that will be responsible for our AEFI composite team. For our queuing officer and crowd control, we have top also local officials from the barangay captains, from our security personnel from the PNP, and our security officers from the such as the barangay tanods, which is more or less around estimates of 20 designates for a particular vaccination site. And the other staff that would supervise the vaccination sites would be sanitation officer, maintenance, and including our drivers and other personnel. So all in all, we expected to have about 42 individuals who will be manning the vaccination sites per site, in Davao City. Identification of vaccination sites, as of now, you are here in Mabini Elementary School, and this is our model vaccination sites for Davao City. But aside from that, we have also the vaccination site in the Southern Philippines Medical Center, and we have at least 5 additional more. The University of the Southeastern Philippines, or USEP, where we had an initial agreement already. Ateneo de Davao University, Matina campus already had a commitment with the management also. And we have 3 branches of the University of Mindanao, namely Gianga, Ilang Tibungco, and Bolton. So yung tatlong branches po ng I have already arranged with Mr. Willie Torres, now the owner, and there's already a letter of request that was submitted, and we have already an agreement. So piniprepare na rin po yung mga campuses po ng University of Mindanao. So initially, we have a total vaccination site that will be prepared very, very soon. And aside from this, the district health offices also were instructed to come up with at least 1 vaccination sites per district. No, we have 18 health districts in Davao City. So aside from these 7 approved vaccination sites in Davao City, we're going to add up additional, I think, at least about 13 or 14 more vaccination sites from the district health offices. Next. So for our cold chain inventory, so far, for our +2 to +8 refrigerators, ito po yung aming counting. Next na lang po. Next slide. So we have a total of 54 available refrigerators intended for +2 to +8 degrees centigrade refs. Then we have 15 available refs for -20. And so far, for our ultra low temperature freezer, we have 1 available at Los Amigos Molecular Lab in Tugbok. So ito, in summary, ito po yung accounting ng aming vaccine refrigerators that available for Davao City. That's about 6970, including the 1 ultra low ref in Los Amigos, which capacitates to more or less around 35,000 vials. And we have 388 vaccine carriers available also for Davao. Next. For our identification of supplies and logistics, we have, aside from the supplemental budget, we have also allocated funds coming from our funds from the DRMMO, no? Yung ating disaster funds. And ito po yung mga following preparations that was made for under the supplies and logistics that was headed by our Assistant City Administrator, Attorney Dwight Domingo. Okay. So for our, we have preparations done for our waiting areas to the registration areas, including yung ating mga IT gadgets and materials. Next. We have also supplies and the logistics intended for our counseling areas, screening areas, including our vaccination areas. And for our post-vaccination areas, no, yung ating post-vaccination area, kinasify pa po namin ito further into 2. We have high-risk post-vaccination area and low-risk vaccination area para po ma-delineate po natin yung ating mga pasyente at hindi po magkahalo-halo yung low risk sa high risk. And you will see it as you go into your walkthrough right after this program. Next. So for the conduct of simulation exercises, this morning actually was the 4th simulation exercise that was done in Davao City, including po yung ating simulation on the process flow of the vaccination operation itself, no? So, meron kaming 3 simulations na ginawa from the airport to the freezer available in SPMC and Los Amigos, and we have also simulations that was done from the airport directly from the site of the ultra low freezer down to the vaccination sites, which was done just early this morning. Next. So, ito na po 'yun. Next. So this is the vaccination procedure, the vaccination team, and the composite team, no? So ito po yung ma-encounter nyo later when you go into walkthrough. When you walk through the vaccination area we have at the back. Okay. So registration, pre-vaccination counseling, and the final consent, then screening, then vaccination, then post-vaccination. So yun po yung ating mga sections under vaccination procedures. Next. So this is actually pictures na lang po ito. This is our waiting area. We are standing right now, or sitting right now, I mean. And next, ito po yung ating registration area. Okay, next, and we have a picture of your counseling area. The counseling will be done not only by the health workers, but we have also augmentation coming from the Philippine Mental Association, no? Which was actually coordinated na po ito sila with our operations center. So madali na po naming natap yung ating mga psychologists and psychiatrists in case we need further screening and counseling procedures, no? Beyond the normal capacity of our healthcare workers. Next. We have screening area, and I think this is the last. We have, next, our vaccination area. And this is the ref that is available in our vaccination area where we can contain our vaccines. Then this is our, lastly, our post-vaccination area. Kadalasan po yung mga stretcher, pinuprovide po yan doon sa mga high-risk post-vaccination area. And we have also benches and stretchers that are prepared doon sa ating low-risk vaccination areas. So I think that sums up our, that wraps up our Davao City COVID-19 vaccination preparedness. Thank you very much po.
Daghang salamat, Dr. Ashley, for giving us a picture of the COVID-19 situation in the city as well as the preparations po na pinaghahandaan ng city for the upcoming COVID-19 vaccination. So also we would like to acknowledge the Director 3 of Department of Education, Ma'am Maria Ines Asuncion. Good morning po. Thank you for facilitating na magkaroon tayo ng comfortable meeting room today. Now, last week, nagkaroon po ng simulation exercises ang Davao City. That is in preparation sa pag-arrive ng vaccines dito sa city natin. The simulation exercise is a critical step in ensuring na yung vaccines pagdating nila dito, ma-deliver natin to the different implementing sites in a timely and safe manner. So the Philippine Information Agency prepared an audio-visual presentation on the series of simulations. Let's watch the video.
at this point, we are now open for questions from the floor. May I just remind you to focus our questions on the vaccination program. So the floor is ready for any questions regarding the presentation and the plan. May I ask Dr. Ashley to come forward because you are the main presenter. Are there any questions at this point? Yes, I think there are microphones provided. Please identify yourself, the media network that you are representing, and the question, and the person you would want to answer your question.
Good morning. Sheila Lisandra po, Radyo Pilipinas. To Secretary Duque, sir, we've done sa walkthrough po kanina sa SPMC. Kumusta po ang Davao City in terms preparedness with regards to the vaccine rollout?
Maraming salamat at muli sa ngalan po ng Interagency Task Force at ng Department of Health, ako po ay bumabati sa inyo ng isa pong napakamagandang araw, lalong-lalo na po sa atin Local Chief Executive of the City of Davao, si Mayor Inday Sara Duterte. Maraming salamat po, Ma'am Mayor, for this very warm reception. The Interagency Task Force and the National Task Force headed by our Vaccine Czar, Secretary Charlie Galvez, and my fellow members of the IATF. Andito po kami para suriin maigi ang paghahanda ng ating pong mga ospital at ganoon din po ng pamahalaan lokal ng Davao City. Ang amin pong napuna o nakita matapos kaming nag-walk through doon po sa Southern Philippines Medical Center ay talaga pong nakakabilib yung kanila pong paghahanda na isinagawa at yung kanila pong simulation na kanila pong ipinakita kaninang umaga ay wala po akong masabi dahil lahat po ng plano maliban na ito po malinaw na nakalinya sa hanay or aligned to our national deployment and vaccination plan. Yan po tinatawag natin the grand plan. And we have noticed this morning as we went through the various steps and sequential at that, no, yung lahat ng elements of our plan are very clearly laid out, no? And so we commend the leadership of the Southern Philippines Medical Center, Dr. Rick Audan, for his commitment and dedication to really ensure that the plan is crystal clear. And likewise, I take this opportunity to congratulate Ma'am Mayor Inday Sara Duterte for her deft orchestration of the creation or the formulation of the Davao City deployment and immunization plan. Congratulations po, Madam Mayor, sa inyo pong napakamalinaw na plano at kasama po ninyo ang napakamasipag na City Health Officer, si Dr. Ashley Lopez. And I take this opportunity to congratulate the City of Davao and the local government unit headed by Ma'am Inday for reversing the trend in the cases, in your COVID-19 cases in Davao City. And I'd like to just uh, let everyone know that we would appreciate it if that trend continues. And having said that, there is no room for complacency because this COVID-19 virus can always come back, and oftentimes it comes back with a vengeance if we become complacent. And we have learned that lesson in Cebu City, where in June, July last year, they had massive spikes of COVID-19, and then the National Task Force went there, uh, laid out all the plans, and put all the systems, mechanisms, and policies along the prevention, early detection, isolation, treatment, reintegration strategy to combat the pandemic. And now, I think they became complacent prior to this several weeks where we now see an upward. There are more spikes in Cebu City. The number of cases is going up. And really, it is unfortunate because we were able to lick the problem. We were able to reverse the surge or the spike in Cebu City, only to lose it, and now we see again. And I hope that all other local government units will take to heart the lesson that should be learned from the experience of Cebu. But nonetheless, I congratulate once again the city government of Davao really for your response. It is deliberate, and I think it is focused, and no wonder we see a downward trend in the number of cases. And I think that you just need to sustain the gains that you have accomplished, and you build on those gains so that you will have more consistency in controlling the cases of COVID-19 here to a level that will not overwhelm your health system's capacity. Hindi po naman natin sinasabi na kailangan ma-zero ang COVID-19. I don't think that is possible at a time when the vaccines are just still coming in, and they haven't even come in fact. But in most other countries, we have seen already a massive reversal in their COVID-19 infections, no? Infection rate, I mean. So, yan po ay dapat ay talagang paninindigan na natin itong ating pong nagawa, at magpursige po tayo, magpunyagi na talagang matuloy na mapababa natin ang kaso ng COVID. We need to do more localized lockdowns, more granular lockdowns to cut the chains of transmission, to really crush, durugin natin itong mga clusterings, no, in some communities, or in many communities for that matter. So we are here, the IATF, the NTF, and the Department of Health, and all collaborating agencies are here to provide the support that is needed to be able to achieve the goal of really bringing down for good your COVID-19 infection rate, so that in the end we will all be able to implement a good, well laid out vaccination plan, and that in turn will help all of us, the nation in general, and Davao City, the Davao region, and Davao City in particular, to regain its once vibrant pre-pandemic economy, and also achieve normalcy once again in the lives of our people here in the city of Davao and back to the era of productivity that keeps Davao really up there in the radar screen of cities in the world that have performed so well. And we have no doubt that Davao will be up to par. Davao City will be up to par in making sure that our vaccination plan will be implemented very efficiently and effectively. And lastly, I just want to make a comment that most plans are excellent on paper, but the proof of the pudding, so to speak, is in the eating. So it is in the implementation that the true test of how well the plan is implemented, no? So you have to execute very well, and the way to do this is do not perhaps be satisfied with the plan as you see it today, because tomorrow you will find out, if you make a periodic review of that plan, you will see opportunities for further fine-tuning of the plan. And as long as there are opportunities to pinpoint, opportunities for fine-tuning, no, your execution will also improve. So that, as they say, the devil is in the details. So the same is true when you implement your plan. Pwedeng meron po tayong sabit doon sa mga maliliit na aspeto ng plano, at kinakailangan po ito ay lagi natin nililipaso at siguraduhin naka-align po ito to the Grand National Deployment and Vaccination Plan. So andito po kami na kinakailangan talaga ay pagkaisahan po natin ito. Hindi po ito kakayanin ng Davao City government lamang, hindi po ito kakayanin ng DOH, Davao Region lamang, hindi po ito kakayanin ng NTF lamang, ng IATF lamang, hindi po ito kakayanin ng pribadong sektor lamang, kung hindi kinakailangan po itong napakamagandang oportunidad o pagkakataon, magkaisa po ang sambayanang Pilipino para po maisulong natin ang bayan at matalo natin. Isa pong digmaan ito. Kailangan mapagwagihan natin itong laban na ito. Mahirap po itong kalaban na ito. Hindi po natin nakikita. Hindi po natin naamoy. Hindi po natin nararamdaman siya. Bagkos kung asa loob na lang katawan at nagkaroon na tayo ng sakit, doon lang natin nalaman na andun na pala. And it is good to remember that the battlefield upon which we must win the war against COVID is in the individual person. Kasi hindi po natin nakikita. By the time you find out, may symptoms ka na. By the time you find out, your grandmother, your grandfather are already in the ICU. Okay? So, ang hirap. Kaya nga, meron din tayong talagang malinaw na prioritization plan. Nakita ko yon sa inyong plano. I commend you for making it very clear, and you have highlighted the priority groups. These are all the healthcare workers in all the healthcare facilities, both local and national, as well as public and private. So, kinakailangan hindi lang po tao-tao, kundi yung buong institution. At madalas pong sabihin ni Secretary Galvez, we have to protect the integrity of the healthcare system. So, yan po ang gagawin natin. Lahat ng mga nagtatrabaho sa ospital, hanggat sa maaari po, ay magpaturok po tayo. Ginto nga po itong bakunang ito, pinag-aagawan po ito sa buong mundo. Kailangan po natin ang inyong suporta. Ma'am Mayor, kailangan po natin na hikayatin ang ating po mga kababayan dito na magpaturok at magkaroon po ng tiwala at paniwala sa pagiging ligtas at epektibo at dekalidad na bakuna na darating po sa Pilipinas. Lahat po itong bakunang ito ay susuriin maigi ng ating FDA. Andyan po si Director General Dr. Eric Domingo na hindi na po natutulog yan. Talaga po nga araw-araw walang ginawa kung hindi tignan, suriin ang lahat ng mga dokumento, masiguro lamang na ito ay tunay na ligtas at epektibo. So, yun lang po ang ibig kong bigyan diin, yung ating pong mga bakuna, kahit na yan po galing sa Russia, sa Amerika, sa China, sa UK, kahit na saan po manggagaling yan. Yan po lahat talaga mapagkakatiwalaan. Yan po talaga makakasiguro po tayo na ito ligtas at dekalidad, epektibo at higit sa lahat libre. Ano po, wala po tayong babayaran dito at alam po natin na ang bakuna ay talagang makakapagpigil ng ating tinatawag na severe COVID infection. Eh naman po, ang napakamahalaga para hindi po na ospital ang atin pong mga magkakaroon ng COVID-19. So itong bakuna na po ito ay nakikiusap po ako sa lahat, ang ating pong mga guro, ang ating pong mga namumuno sa sektor ng edukasyon, ano po, sa lahat po ng ating gobyerno, both local and national, na pagka may pagkakataon po, hikayatin natin, kumbinsihin natin na ang mga bakunang ito talagang okay sila. Wala po tayong dapat agam-agam. Wala po tayo dapat pagdududa. Dahil ginagawa po ng FDA, ang ating Department of Science and Technology, yung Vaccine Expert Panel, napakamagagaling po ng mga scientists, ng mga virologists, ng mga immunologists, ng mga infectious disease experts. Nagbuo-buo na po sila para talagang siguraduhin ang pagbibigay ng ligtas at epektibong bakuna. So wag po tayong mag-aalala, kami po ng buong IATF at I am sure that the good mayor herself will be willing to have herself immunized or vaccinated. So lahat po kami, si FDA Eric Domingo, mauna po yan. Si Secretary Charlie Galvez, mauna din po yan. Ako si Secretary Nograles, CAMSEC Nograles, Carlo Nograles. So lahat po ng IATF, NTF ay talaga po magpapabakuna. Hindi po na kami mamimili, wag lang kung meron may allergy. Kasi may mga iba po, kinakailangan ang assessment ng doktor para lang po siguraduhin na walang mga kaakibat na mga hypersensitivity reactions, no, kapag tinanggap ang anuman bakuna. Pero by and large, ang benefit o benepisyo na ibinibigay po ng bakuna ay sadyang napakamataas, no, compared sa ika nga sasabihin natin, okay lang, magkasakit ako, yung pagka nagkasakit po kayo, yung complications, yung komplikasyon po, yan po ay posibleng makamatay. Kaya yung threat ng COVID-19, maiibsan, mababawasan po natin kung tayo po ang magpapabakuna. Dahil po ang benepisyo, talaga po naman napakamataas. Ang cost, napakamababa. So ito lang po ang ibig kong bigyan diin sa gitna ng ating pong nasaksihan na magandang plano. Congratulations again. Let's give a big round of applause to the city government of Davao for their very clearly laid out plan. And we are here offering our services, Ma'am Mayor Inday, to complement if there is anything that you need us to do to really achieve our goal of protecting public health, of preventing, if not reducing the COVID-19 mortality and morbidities. Ano po? So again, sa ngalan po ng IATF, DOH, maraming salamat po at magandang umaga.
Thank you very much, Secretary Duque. Can we have now some messages from CABSEC Carlo Nograles?
Maraming salamat. No? In behalf of the entire national government na nandito po ngayon, kasama ko si Secretary Duque at ang buong puwersa ng Department of Health, si Secretary Galvez, at buong puwersa ng National Task Force, si Spokes Harry Roque, at lahat ng mga nandito ng mga government agencies from the National, DepEd, PIA, FDA, si DG Domingo, at lahat na, DILG, si Yusek Epimaco Densing. Kami po ay lubos na nagpapasalamat kay Mayor Sara, Mayor Inday Sara Duterte at ang buong puwersa ng Task Force COVID-19 ng Davao City. Bago ko ibigay ang aking mensahe bilang isang empleyado ng gobyerno, ay hayaan niyo po ako magbigay ng isang testimonial muna. In behalf of my family, sa pamilya po namin, lalong-lalo na sa ako ang inahan, kami ay kapasalamat ug dako kang Mayor Inday Sara ug ang tibok puwersa sa Task Force COVID-19 diri sa Davao City. Kay sayod si Mayor Sara nga ang akong mama just last month na takdan siya og moderate COVID-19. So ang tanang gipakita diri sa Davao City nga ilang preparasyon, buhing saksi ang akong pamilya. Na kining tanan na ilang gipakita is mao gyud na ang ginabuhat diri sa Davao City. Dako nga mong pagpasalamat na gikan sa tanang aspeto sa response team sa Davao City. Gikan sa pag-test sa akong mama, nag-positive siya. Paspas kayo, mabilis ang paglabas ng resulta ng testing. Hantod sa pagpangita sa iyang hospital room, kay moderate na ang iyang COVID. Hantod sa pag-quarantine o isolate sa among balay, pag-test sa tanang mga naa dito sa sulod sa among balay, pag-contact tracing sa tanang mga close contacts, kining tanan gibuhat. Ug kami dakong among pagpasalamat sa mga doktor nato nga maayo gid ang pag-atiman sa akong mama. Led of course by our infectious disease expert diri sa Davao City who has saved countless lives in Davao City. I would like to thank personally Dr. Yvette Bares, who also heads and is very active sa preparation for our vaccination rollout diha sa SPMC. Si Dr. Uyking Naranjo, si Dr. Guillermo, of course si Dr. Audan ng SPMC. Nakita talaga namin kung gaano ka-prepared ang SPMC. Si Yusek Dumama, Yusek Vega, and lahat ng mga bumubuo ng Davao City team. 21 days ang akong mama kay nagka-develop siya og pneumonia. And I'm very thankful, our whole entire family is very thankful nga nakasurvive ang akong mama sa moderate na COVID-19 episode. Busa, Mayor Sara, sa pamilya namo, labi na sa akong mama nga gipangga gyud ka sa akong mama, dako nga mong pagpasalamat sa inyo ha, sa imuha personally, who leads the Task Force COVID-19 diri sa Davao City ug ang tibok puwersa sa Davao City. Salamat kaayo gikan sa among pamilya, dako nga among utang kabubuton kanimo ug sa entire Davao City, and we are here to support you in everything and anything that you will do. Come what may, Mayor. Salamat. Daghang kayong salamat kanimo. And on as a government employee, we'd like to also thank lahat ng pinakita na preparation prepared. Mahilig ang Davao sa simulation exercises. Pagdating sa national disaster simulation exercises, fire drill, name it, ang lahat ng disaster preparations ginagawa dito sa Davao City. So itong vaccination simulation exercises, kalalabas pa lang namin ng SPMC, tinext na ako ni Dr. Yvette na mag-simulation exercises na naman sila bukas para mas lalong pahigpitin pa nila ang lahat ng kailangan gawin to improve the vaccination rollout. To the registration, nakita natin na halos lahat, kung hindi lahat na nasa priority A, na register na po ng Davao City. And I know that Davao City has a Davao City QR scan code, QR code, and this is used for contact tracing. But to level up and to use that contact tracing QR code, ginagawa na rin ng paraan ng Davao City to integrate that para sa registration ng mga mabavaccinate o mapabakunahan diri sa Davao City. So that in itself is already a very laudable and a good example or best practice that can be emulated by other cities as well. No? At kami nagpapasalamat sa ginagawang preparation sa mga vaccination hubs like here in Mabini, like in other places in SPMC. Lahat po yan naka-roll out. Just let me tell you a little bit about Davao City. But Davao City is one of the largest cities in terms of land area. And klase-klaseng barangay, klase-klaseng karakteristik na. Nami mga barangay nga gagmay but dikit-dikit ang balay, nami mga barangay na dagko, lapad kaayo, and magkakalayo ang barangay. So each and every barangay has its own distinct characteristic and unique character. So ang gikinihanlan gyud para ani is kinilang kutig yun. Kailangan micromanage talaga and look at all of the details. And we're very lucky to have Mayor Inday Sara Duterte because I know her to be a leader who really looks at the finer details at nakita naman ninyo sa lahat ng pinakita ng Davao City dito. Lahat ng mga detalye, planchado. Ang kulang na lang po yung vaccine. But as far as preparations in Davao City, it's excellent. It is an example. It is a benchmark. Sukaran kini. And it's also very challenging. Davao City is a melting pot. Sulod gawas. Negosyo diri tao, klase-klaseng tao. In fact, even patients from all over Mindanao come to Davao City kung magpa-hospital. So it's very challenging to manage. But because of the very excellent management skills of our beloved mayor, we've been able to control the cases in Davao City. But that's phase 1 of the fight. Phase 1 pa lamang na tanang gibuhat diri sa Davao City is in preparation for this next phase. The next phase and the long-term solution is the vaccination rollout. But if it's any indicator, ang tanang gibuhat in terms of phase 1 been very excellent, and so kumpiyansa kami na phase 2 will be done even better if that is even possible. So Mayor Sara, aging pagbalos kami sa national government, of course under sa imong amahan, we will ensure and make sure that the vaccination rollout will be very successful not only in Davao City but in the entire country. So congratulations kanimo Mayor Inday, more power to you, daghang salamat and God bless you.
Thank you, Cabsec Nograles. Before we proceed, may I acknowledge the Regional Director for DepEd Region 12, Ms. Panchet Bringas. Now, may we hear some messages from the Chief Implementer and the Vaccine Czar himself, Secretary Carlito Galvez.
Unang-una po sa lahat, maraming salamat po, Madam Sara, Madam Inday, Sara Duterte, ating pinalangga na Mayor, sa inyong very warm welcome. And then sa lahat po ng mga cabinet members po na nandito po ngayon, na hindi ko na po babanggitin, at saka ating mga ibang government employees and also member of the IATF and also the member of the response teams of the Davao City. Nandito po kami ngayon dahil sa pag-uutos po ng ating mahal na presidente na tingnan po ang ating preparasyon at nakita po namin talaga, Mayor, yung SPMC, talagang very impressed po ang yung nakita po namin, one of the best na nakita namin preparation, even yung pinaka-smallest details, yung mga lalagyan ng mga syringes na after use. And then lahat, pati yung natutuwa nga ako, Mayor, meron pang photo booth na I survived yung vaccination. And that's one thing na nakita namin na very unique. Iba talaga ang mga Davaoenyo. At natutuwa po ako talaga si 1986 and 89 na assign po ako talaga po dito sa Davao noong kabataan ko po na sa young lieutenant. And really, ang Davao is special po sa amin, lalo na po sa mga military na pagka once na na-assign po dito. At ma'am, masa po kayo, hindi namin po pabayaan ng Davao. At makakaasa po kayo na yung vaccination program, kasama po ang Metro Manila at lahat ng mga highly urbanized cities. Uunahin po natin yung mga, lalo na po yung mga mostly affected. And we are very thankful na you were able to hurdle yung challenges. Nakita natin, napakahirap talaga ang yung COVID, pabalik-balik. Nakita natin na isa sa Metro Manila na talagang sinalanta, and then yung sumunod, yung Cebu, and then yung Davao. And we're thankful that Davao really been very resilient. And Madam, yun lang po ang pangako namin na we will always serve Davao City at rest assured na wala po maiiwan at hindi po maiiwanan po ang Davao City. Maraming salamat po, Madam, at mabuhay po tayong lahat.
Thank you, Secretary Galvez. Can we hear some words from Director General Eric Domingo of FDA?
Hello, magandang tanghali po sa inyo lahat, Ma'am Mayor. Good afternoon po. Sa mga kasama namin po rito ng mga secretaries and government workers and lahat po ng kasama natin ngayon. Natutulog pa naman po ako, no? Mga 2 oras sa isang araw. Pero gusto lang namin po kayong assure, kaya naman po kami lumipad papunta po talaga ng Davao. On my part sa FDA, we would like to assure everybody na ginagawa po talaga natin lahat para masigurado na ang mga bakunang gagamitin natin angkop, no, para po sa atin. Sabi po kagabi ni Presidente, kamiting po namin siya kagabi, gusto niya meron tayong option ng mga 4 o 5 bakuna na magagamit kasi wala naman pong isang kumpanya na kayang mag-supply para sa 100 million Filipino within the year. So we really need a basket, no? Marami pong choices. Sa ngayon po, meron po tayong mga expert na yung iba po dyan kilala ninyo. Wala po silang ginawa kasama namin na suriin araw-araw. Basta po safety, ang issue, hindi po yan negotiable. No? Basta may safety issue, wala pong papasang bakuna sa atin. And of course, we want to maximize po yung efficacy, yung effectiveness niya na magkontra sa COVID. Sa ngayon po, meron na tayong 2 approved na vaccine dito sa Pilipinas na merong tinatawag nating emergency use authorization. Yan po yung Pfizer at saka yung AstraZeneca. At yan po na-approve ng FDA natin at na-approve na rin po ng WHO. Kanina pong umaga, nag-announce ang WHO, pati yung AstraZeneca, in-approve na po nila. Meron pa po kami mga pending na mga ine-evaluate ngayon, yung pong sa Sinovac, yun pong Sputnik, at sa tingin ko po itong linggong ito, tsaka next week, meron pang ibang mag-a-apply, katulad po ng Moderna, yung Novavax, na mga posible rin po mag-supply yan sa atin. At sigurado ko po, no, pinapangako ko sa inyo, hindi namin ito i-approve kung talagang hindi tayo sigurado. Safety first, tapos efficacy, at kung papayagan po natin gamitin sa publiko ito, sabi ko nga, dapat payag kami na iniksyon sa sarili namin tsaka sa mga pamilya namin. Kung pwede ng lapat na bakuna, pa-iniksyon ako lahat para mapakita, no? Pero isa lang po pwede, no? Hindi po pwedeng paghalu-haluin ang mga bakuna. Pagkatapos naman po, pag nag-start na tayo ng vaccination, kay Dr. Lopez, we will be supporting you, no? Yung FDA po, nandito ang ating Mindanao East Cluster, no? Itong si Director Debbie natin, nandito po siya. We'll support you to make sure yung ating cold chain, yung quality po ng ating mga bakuna will be checked to make sure na pag in-injection po natin yan, nasa magandang kalagayan po yung ating mga bakuna at maximum yung effect na makukuha po natin dyan. At yun lang po, gusto ko lang pakiusap sa atin pong City Health Office at saka sa lahat po, nandito rin po mga tiga SPMC sa atin. Since the vaccines will be approved under emergency use authorization, ibig po sabihin talagang may mga kailangan pa tayong malaman sa mga bakunang ito. Bagamat at this point, alam na natin na magandang effect niya, syempre babantayan po natin lahat ng mababakunahan at yung ating adverse event following immunization reporting is very important. Natutuwa ako doon sa report kanina ni Dr. Lopez doon na nag-training na tayo sa VigiFlow. Ang ibig po sabihin nun, ang Davao City connected na sa system ng atin pong reporting ng adverse events sa buong Pilipinas, sa regional office, sa FDA, at ang FDA naman po connected kami sa WHO at saka sa FDA counterparts po natin sa buong mundo. So pag may nakita po tayong anything unusual, anything suspicious, madali po natin yang matingnan at maimbestigahan para malaman po kung kailangan nating baguhin ang ating mga strategy. So ang FDA po will be always supporting the City of Davao, kay Dr. Lopez sa team niya, si Madam Mayor Inday Sara, lagi po kaming, may opisina po kami dito at tututukan po natin ang mga bakuna ninyo. Maraming salamat po.
Thank you very much, Dr. Domingo. Now can we hear some words from Undersecretary Epi Densing of the DILG?
Mayong udto sa atong kanatong tanan. Before I deliver my very short message in behalf of the Department of Interior and Local Government, bation lang nako ang inyong palangga, ang inyong inahan sa syudad, basin mainahan pa sa atong nasod, Mayor Sara Duterte Carpio. And I'd like to give recognition also to our national leaders who are in front of you. These are the people, the reason why we are able to control and contain the COVID-19 virus in the previous year, and the Philippines being recognized as the best performing country in terms of COVID-19 response. Nandito po, sila po ang palakpakan talaga po natin na gumawa po nito at gumawa ng posible. Secretary Doc Duque, Secretary Galvez, at ang inyong palangga din, ang anak ng Davao, Secretary Carlo Nograles, at ang tagapagbigay ng tamang impormasyon, ang ating presidential spokesperson, Mr. Secretary Harry Roque. Isa rin pasalamat sa ating DOH team na nandito, kasama rin ho si DG Eric Domingo, nandito po si Dr. Ted Herbosa, at sa buong DOH team, at sa mga lokal na opisyales, palakpakan po ninyo inyong mga sarili. For the Department of Interior and Local Government, I think as early as the previous month, we've already issued an important memorandum circular to all local government units all over the country for you to start implementing or do your pre-implementation plans of your vaccination program in alignment or in accordance with the national vaccination program of the government. We've already met around, including this morning here at the Southern Philippines Medical Center, and we know and we feel that you're all ready. We are just awaiting for the arrival of the vaccines for us to formally start the vaccination process to our fellow Filipinos. But in the memorandum circular that we've issued, there's one important directive that is now the special emphasis of the vaccination cluster of the IATF. And the emphasis is for us, especially in the local government, to help us convince and create that feeling of confidence from our fellow Filipinos that the vaccine is important to us, that it is safe, that it is effective, and it is actually one of the solutions for us to overcome this crisis of the global pandemic, the COVID-19. Maayo sa akong mensahe, nang hangyo ko sa inyo, natabanga kami na maingon sa atong mga kababayan diri sa Davao, diri sa Tibok Mindanao, sa Visayas, nga magpaturok, magpabakuna, kay usa ka tuig na nato gihuwat ni mo abot ng bakuna, karon ni abot na, moabot na, magpabakuna ta. Maugyod ni ang kasagaran nga solusyon nato sa atong kalusugan, sa atong health, maupog solusyon para maibalik nato ang atong ekonomiya na katong 2020 ni hagbong gyud. The Philippines became the worst performing economy in 2020 in Asia, in the world. But what is important is that we were the best performing country in terms of making sure that the Filipino health or the health of the Filipino is there. Sabi nga nila, kalusugan muna bago kita. At ngayon dahil naibalik na po natin itong posisyon na ito, na ibalik yung ating ekonomiya, na contain po natin ang virus, panahon na po para ibalik natin ang ating pananaw para maibalik po ang ating ekonomiya. Kaya nga, nangayo tabang sa inyo na ingnang atong mga kababayan nga magpabakuna. Kay kumahimo, mabakuna ni. Ingon pa sila sa DOH, kung mabakunahan mo, kung ang COVID-19 leon, mahimo ni kuting. Kung ang COVID-19 pakalat-kalat, with the vaccination o kung mabakunahan mo, mabutang ni sa kulungan. So mauning atong objective, kung mahimo na nato karon in the next few months, then at the end of the day, it's the Filipino nation who will benefit from this national vaccination program. Mauni ang atong himuon, dili lang para sa atong kaugalingon, sa atong pamilya, sa atong komunidad, mauna ni ang ambag nato sa atong nasod. Daghang salamat paayong hapon sa atong kanatong tanan.
Fresh from the TV show that he had, may we hear from Presidential Spokesperson Harry Roque.
Maayong udto sa inyong tanan, Mayor Sara, ang aking mga kasama po sa IATF at Gabinete, at siyempre po sa lahat ng mga taga Davao. Unang-una po, nagpapasalamat po ako sa lahat ng mga Davaoenyo dahil pinahiram niyo po sa amin ang ating Presidente Rodrigo Roa Duterte. Kung hindi niyo po pinahiram ang ating Presidente, siguro po tayo po ay wala nang nangyari sa panahon ng pandemya. At ang Pilipino naman po ay merong utang na loob. At sa mga pag-aaral na ginawa po ng mga polling companies, ang husga po ng taong bayan, 9 sa 10 Pilipino ay nagsasabi na sapat at tama ang mga ginagawa ni Presidente Rodrigo Roa Duterte pagdating dito sa pandemya ng COVID-19. Nagpapasalamat po ang Presidente sa inyong tiwala at nangangako po siya na sa huling hugto nitong laban natin, laban dito sa pandemyang ito, ang pagbabakuna, wala pong maiiwan, walang iwanan, lahat po tayo magkakaroon ng bakuna, nang lahat po tayo'y makabalik buhay sa ating buhay kung saan tayo nakakabiyahe, tayo'y nakakaikot, at babalik rin po sa normal ang ating mga buhay. Marami pong mga kritiko ang Presidente, pero wag niyo po silang pansinin dahil kakaunti lang naman po sila. Ang ating mga paghuhusga kung tama nga ba ho ang ginawa ng ating Presidente, ibase po natin sa datos. Ano ba ho ang datos? Sang-ayon sa World Health Organization, napilit na sinasabi ng mga kalaban ng ating Presidente na di umano ay propaganda daw. Unang-una, tignan po natin ang datos sa total number of cases. Tayo po ay number 31 lamang sa buong daigdig. Tignan naman po natin yung ating mga number of active cases. Tayo po ay nasa number 41 lamang. At kung tignan po natin yung active cases per 1 million, tayo po ay nasa 134 laylayan. At kung titignan po natin ang case fatality rate, tayo po ay nasa number 66 lamang sa buong daigdig. So mga Davaoenyo, ito po ang nagpapakita na iyong pinahiram na Presidente Rodrigo Roa Duterte, tama po ang kanyang mga nagawa dito sa pandemya ng COVID-19. Marami pong mga kaaway natin na magsasabi, nako, palpak ang vaccination daw. Bakit hanggang ngayon wala pang bakuna? Huwag po kayong maniwala sa kanila. Ang katunayan po, ang buong mundo'y nagsisimula pa lamang ng kanilang mga vaccination rollout. Hindi po tayo nahuhuli. Ang mga tanging nauna lamang ay ang bansang Amerika at ang China, mga bansang gumagawa ng mga bakunang ito. Ang ating ilagay po sa ating isipan at damdamin, ang sinabi ng Pangulo, lahat ng Pilipino babangon sa COVID-19, walang iiwan at walang iwanan. Magandang hapon po sa inyong lahat.
Thank you very much, Spokes Harry Roque. Can we have some few words from Dr. Aleli Sudyakal? Are you around? I'm here.
Thank you, Dr. Rapaz, Mayor Inday, other city council officials, mga Davaoenyos po, sa ngalan po ng national and regional government, we congratulate the City of Davao and the Southern Philippines Medical Center for, as RD Yumang said, the top-notch COVID-19 preparations of the city. My secretary po, Secretary Duque, has already given the thumbs up to the City of Davao for its preparations. Ako po ay naatasan lang na magbigay ng dagdag kaalaman na we hope the city will be able to employ. Number 1 po, we will be requesting the city to submit a readiness assessment report, updated readiness assessment report, with the objective for us, national government and regional government, to determine how else we can help the city. Number 2, it is very good po from the presentation of Dr. Ashley Lopez earlier, you already have a sub-prioritization plan aside from identifying your COVID referral hospitals. The reason why I'm mentioning this is that aside from identifying your sub-prioritized health facilities, sir, we have to have a QSL. I'm sure you know already what a QSL is, but we will be requesting you to submit your QSL to the regional government and to the national government. The quick QSL po is a quick substitution list just in case some of our health workers will be refusing. So this is not mandatory naman po kasi. So if they will be refusing to be vaccinated, then we have to have a list kung sino yung ating fillers. You've heard already na itong bakuna po natin ay ginto. So dapat walang masayang. Hindi tayo mapupulaan. We commit na hindi tayo mapupulaan for wasting these precious vaccines. So meron po dapat tayo pang palit na to be vaccinated. Number 3, the national government po, through the regional offices, particularly our Center for Health Development, RDUMANG is here, will be helping the city assess its non-health facilities which will be used as vaccination centers. And then last, come Vaccination Day po, alam nyo naman, ang atensyon ng mundo ay nasa Vaccination Day. So the whole Philippines actually. And Davao is the Mindanao representative sa ating first round. Visayas, Cebu will be the one for Visayas. Why am I saying this? Everyone will be looking to you on how you will implement. If you fail, it can have an implication on the overall implementation of our program. But rest assured, Sec. Galvez has mentioned it, andito po ang national government and ang regional government para tumulong po sa ating mga local government units para maging successful po ang ating COVID-19 vaccination program. Yun lang po, maraming salamat.
Thank you very much. And now we have the walkthrough on the vaccination site. And may I call on Dr. Rubio and Dr. Villafuerte to lead the principals as to the walkthrough on the vaccination site of this school.
Doktora, walkthrough, gawin na muna natin yung press conference natin dahil we are now live on PTV4 and in all our in all our partner channels who are members of the Kilusanang Broadcaster ng Pilipinas. So muli po, magandang hapon po sa inyong lahat. Nandito po kami uli sa Davao City, sa Apolinario Mabini Elementary School, kung saan nagkaroon po ng code visit para malaman po ang kahandaan ng syudad ng Davao sa parating na pagbabakuna. At sa ngayon po, kasama po natin ang mga miyembro ng lokal na media dito po sa Davao City at via Zoom kasama rin po natin ang Malacanang Press Corps. Lahat po ng tanong ng Malacanang Press Corps will be coursed through USEC Rocky. Nandito po sa ating harapan ang ating Cabinet Secretary Carlo Nograles, DOH Secretary Duque, Mayor Sara Duterte, and NTF Chief Implementer and the Vaccine Czar Secretary Galvez. You can address any or all of your questions to anyone po in the rostrum right now. May I ask our PIA, sino po ang taga-PIA who will act as moderator for the questions coming from the local media? And we will do this alternately, no? Siguro isang question from local media, isang question from Malacanang Press Corps. Sir, can you introduce yourself first?
Yes,
and then you can call on the
Secretary.
first question from the local media.
Mayong hapon kaninyong tanan, ako si Joey Sam Dalumpines, Information Officer 3 sa PIA 11. Ug ang first question natin ay mula kay Jem Abansendia ng TV5. Please formulate 2 questions, 1 main and 1 follow-up, and address it to someone in the rostrum.
Pakibigyan lang ng mic, PIA, yung ating media, wala silang mic doon.
Microphone, please.
Please identify yourself and kung para kanino po yung tanong.
Hi po, good afternoon. I'm Jem Abansania po of TV5 excuse lang po, for Secretary Duque. Dr. Nixon calls for the abolition of IATF, saying na unscientific daw po yung ilan sa mga decision, katulad na lamang po nung pagpayag ng opening ng cinemas. And binibito naman daw po ng mayor. What's your reaction on this, Secretary Duque?
Thank you for the question. The IATF is collegial body, okay, represented therein by the department secretaries and other heads of national government agencies. Our function is really to make recommendations, no, to the president, and it is really up for the president to see the good that those recommendations may produce. But you see, the sources of information of the president, no, is well beyond the IATF, because he also talks to other sectors, and he is always a listening president. So that ang perspective ni Pangulo, it's broader and deeper. So that if and when he thinks that some of the recommendations of the IATF stand improvement, then we have to respect that. And we follow what the final decision is of the president.
Siguro dadagdagan ko lang yan, no? Nagkaroon na po ng desisyon. Yung resolution naman po ng IATF, kung babasahin nyo, it is subject to guidelines to be issued by both the local government and the Department of Health. The Department of Health right now is coming up with protocols kung paano po natin gagawin ito, kung matutuloy. And the LGUs now are in the process of issuing guidelines should they wish to allow the opening of cinemas. Hindi po naman binabaliwala ang posisyon ng mga alkalde, kaya sa resolution po mismo nakaspecify doon that the opening eventually is subject to guidelines to be issued by them. Pero siguro po, lalagay ko lang po sa perspective yung mga aksyon na ginagawa ngayon ng IATF, kasama na yung pagre-rekomenda ng MGCQ sa buong Pilipinas. Meron po slide dito, sana po magamit dito sa overhead, no? Pero yung sa analysis po ng NEDA, tinitimbang po natin na yung total number of COVID cases po natin ay 550,000, ang active cases natin ay 27,500, ang COVID deaths natin ay 11,500. Sa kabila naman po, yung pagkagutom ng ating mga Pilipino, meron na po tayong mga karagdagang nagugutom na Pilipino na 23.7 million Filipinos, additional poor people na 4.5 million, additional unemployed na 2.7 million, and all other deaths of 480,338. Ito po ang dahilan kung bakit nagkaroon ng consensus na talagang kinakailangan unti-unti natin buksan ang ekonomiya. Pero ang ine-emphasize po natin, unti-unti pong binubuksan ang ekonomiya, pero hindi po tayo nagpapabaya doon sa ating minimum health standards. Kinakailangan sundin pa rin yung pakiusap ng ating presidente, mask, hugas at iwas.
Thank you so much, Secretary. One last question po. AstraZeneca will no longer be accepting orders na daw po, while Novavax naman daw po is limited na lang daw po yung kanilang masusupply. Ano po kaya yung magiging implication nito, Secretary Duque?
Secretary Galvez o Secretary Duque?
Sorry, Secretary. Anybody could, ano naman po.
Siguro Secretary Galvez as the vaccine czar. Ano ulit yung question?
Ano yung magiging implication since AstraZeneca daw po will no longer be accepting orders, while sa Novavax naman daw po is limited lang po yung mai-provide nila?
Nakita natin yung ano naman yung sa AstraZeneca, meron tayo na order na 17 million. And yun po ang total volumes na inoffer po sa atin na nakuha ng private sector at saka ng LGU. So 11 million po total po lahat ang nakuha po ng LGU and 6 million naman po doon sa private sector. Bali po kasi ang nangyari yung sa AstraZeneca, yun na po ang total volumes na pwede po nating makuha. So wala na po tayong volumes na available considering that all other regions have already gotten yung AstraZeneca volumes. And ngayon, nag-offer po ang Novavax from Serum Institute of India na meron po tayong 10 million na pwede pong paghatian ng private sector at ng ating mga LGU. So ngayon po, ongoing po ang negotiation nila and considering also na yung Senate at saka Congress ay ginagawa po yung bill na sa batas na i-allow na po ang LGU through tripartite agreement na magkaroon ng cash advances ay lalo pong magiging nasikasik po ang ating LGU na makakuha ng additional volume sa Novavax.
Tatanong ko lang kung merong question si Yusek Rocky from the Malacanang Press Corps. Yusek Rocky, you have questions from your end? Okay, wala pa pong response. Next question, please.
Next question is from Chair Palecte of Philippine News Agency.
Good afternoon to Secretary Galvez, sir. Sir, when are we expecting in Davao City po yung vaccine? And Dr. Lopez presented na kailangan po ng 500,000 vaccines for the priority respondents. Paano po yun, sir? Makaka-allocate po ba sa Davao ng ganun kalaking doses?
Based doon sa latest po natin, yung COVAX nga po ay magbibigay sa atin ng more or less 5.2 to 9.3 na vaccines ng AstraZeneca at saka ng Pfizer. Ang kanilang pong expected na arrival is this coming February and March. And also yung sa natin sa ating allocation dito sa Davao, ang uunahin po muna natin yung mga tinatawag natin na mga COVID dedicated hospitals, yung ating LGU hospitals at saka yung ating mga private COVID hospitals. So after the COVAX, mayroon po tayong parating din na Sinovac pagka once na-aproba na po ng EUA yung Sinovac and also Gamaleya. Mayroon po rin po parating na more or less 1.5 million, 1.6 million this coming February and May. Meron pong dinonate ang China na 600,000 na Sinovac na darating po din ngayong February po. So yung po natin, kaya po napangako natin kay Mayor Sara na talagang hindi po natin pabayaan yung kanyang yung ating population na target na more or less 800,000. Titingnan po namin at yung lahat na po na padating this coming first quarter and second quarter, we will allocate equitably with what we can give for Davao, particularly in preserving its healthcare facilities and also protecting the tinatawag nating vulnerable sectors and societies. Yun po.
Okay, may question from Yusek Rocky. Yusek Rocky. Ang tanong po ni Pia Gutierrez, ano daw po ang reaksyon ng palasyo doon sa dismissal ng election protest ni Senator Bongbong Marcos labang kay VP Leni Robredo? Yan po ay desisyon ng kataas-taasang hukuman. We respect that and we respect also that the camp of Senator Bongbong Marcos has a further remedy of moving for reconsideration. Okay, Yusek Rocky. Ang tanong po kay Maricel Halili, Dr. Tony Liachon calls for the abolition of the IATF for decisions such as the reopening of cinemas, which he claims has no scientific basis. Ang tanong ko po kay Dr. Tony Liachon, Sir, the President has addressed your views. You are sour graping because he did not appoint you as Secretary of Health. Pasensyahan na lang po. At saka may dadagdag pa po si Secretary Galvez.
Ang advice ko lang kay Dr. Lechon, hindi mo pinagbuti ang trabaho mo sa NTF at saka nakita natin na meron kang ulterior motive aside from serving our people, kaya tinanggal po namin kayo. So yung pa lang nakita natin na si Dr. Lechon po talagang wala pong word of honor yan, talagang ang hirap makasama.
Kapag nagalit mo naman si Secretary Galvez, ewan ko na, itignan nyo naman si Secretary Galvez, hindi yung gaya ko, napakabait niya, ako maldito. Anyway, next question please.
Hurdle Tokmo of ABS-CBN. Hurdle?
Good afternoon, I'm Hernal Tokmo from ABS-CBN News. My question is for Secretary Galvez. Sir, what was accomplished during your meeting with the COVAX facility last Friday?
Yung tungkol sa sa indemnification
Yes po.
agreement. Actually yung nakausap-usap ang ating mga lawyers pertaining sa indemnification agreement. Napirmahan na po namin ni Secretary Duque at saka po ni Secretary Dominguez yung proposed COVAX indemnification agreement. Yung bola po nasa kanila po ngayon. So yun na po, yung ating indemnification agreement ay napag-agrihan na ating pong isubmiti sa COVAX po. Then we are just waiting for the details on the lawyers of the Pfizer on their tinatawag nating mga additional requirements.
So where are we in the efforts, sir, to comply Pfizer's indemnity requirement? Has the Philippines submitted its indemnity plan to Pfizer?
Ongoing pa ngayon yung ating arrangement with Pfizer kasi based doon sa pagka-uusap ng mga lawyers na aside from the COVAX generic indemnification agreement ay kailangan bawat mga manufacturer na mag-supply through COVAX kailangan merong individual indemnification agreement. Sa ngayon po nire-resolve po natin 'yon dahil kasi ngayon po ang ating Senado at ang ating mga congressman, they are working very hard na magkaroon po tayo ng tinatawag nating indemnification clause sa mga ginagawa po ng bill, ng Senate bill at saka yung ating mga Congress bill ngayon para magkaroon po tayo ng at least yung recommendation po ng DOF, magkaroon po tayo ng indemnification fund na more or less 500 million para sa ating mga future adverse effect beneficiaries.
Balikan naman natin si Yusek Rocky. Yusek Rocky, meron ka pang tanong galing Malacanang Press Corps? Okay, ang question po galing kay Melo Acuña, has the IATF considered more stringent requirements for the entry of foreigners given the outbreak of Ebola? And what is the budget for the vaccine layout, no? Yung budget naman po natin, no? Siguro si Sec Galvez will tell us about the total budget for our vaccination program.
Sa vaccination program na ano po natin na ating nailathala na po na mayroon po tayong 82.5 billion. More or less 72.5 billion is allocated for the procurement of vaccines. Ang remaining po na fund na other remaining funds will be allocated for ancillary consumables like the syringes and also the PPEs and other ancillary requirements for sa vaccination like mobilization, training, and other services like the cold chain requirement. yun po ang ano po natin, 82.2 billion po ang ating pondo. Kasama na rin po yung ating multilateral arrangement with ADB at saka World Bank.